Hello and welcome to Lynchburg Live. I'm your host, Linda Smith. According to the National Institutes of Health, sleep apnea affects more than 12 million Americans. A conservative estimate is that approximately 10 million people with the condition go undiagnosed. Many people suffering from sleep apnea think it's not a situation to be concerned about. My guest tonight is Lynchburg anesthesiologist Dr. Tom Delaney. Dr. Delaney will be discussing sleep apnea with us and hopefully answering some of our questions. Dr. Delaney, I'm delighted to have you here. He's a repeat guest on Lynchburg Live.
I'm delighted to be here again. Thank you very much.
All right, I believe everybody in the whole world has heard about sleep apnea, but may not understand what it is. Could you tell us what sleep apnea is, please?
I hope I can.
I hope you can too.
People with sleep apnea stop breathing repeatedly throughout their night of sleep, often hundreds of times in one night. And because of this, their sleep is broken up and fragmented and not restful. It also has a number of other physiologic effects that are detrimental to the patient's health. But essentially, sleep apnea is the repeated stopping of breathing during the night.
What causes it?
The most common cause of sleep apnea, the most common type of sleep apnea is called obstructive sleep apnea, and that is caused by obstruction in the back of the throat, by the soft tissues in the back of the throat, obstruction to airflow. During the night, we intermittently go through stages of profound muscle relaxation, and for us, that comes during the stage of sleep known as REM sleep, or rapid eye movement sleep. During that stage of sleep, which is also the stage during which we dream, we have profound muscle relaxation, which leads to our most restorative sleep and restful sleep, and results in us feeling better in the morning and hopefully all the next day. When we get that profound muscle relaxation, however, the tone of the muscles in the back of the throat relaxes profoundly with all the rest of the muscles. And when that happens, we are liable, some people are liable to get obstruction to airflow in the back of the throat. That is manifested in its most mild form by snoring, in its very mildest form just by occasional mild snoring. However, as it gets more and more significant, the snoring gets heavier and heavier and heavier, and eventually, as the condition worsens, it leads to actual obstruction to the airflow.
How do you diagnose it?
Well, it's suggested by symptoms. It's actually proven by a sleep study, or a polysomnogram, as it's called. The symptoms that we see most commonly, maybe we could go to slide number 4.
Okay.
Could we go to slide 4?
Phil, will you put slide number 4 up for us, please? Thank you. There you go.
There's a screening questionnaire that's used called the Stop Bang questionnaire. It's kind of a silly name, but it's Stop Bang stands for the 8 leading symptoms of sleep apnea. The first one is, the S is snore. Do you snore loudly? If that's a positive, if you have a positive answer to that, that's one positive response. The next one, the T, is for tired. Do you often feel tired or fatigued during the daytime? The O is for observed stoppage of breathing. In other words, your sleep partner, does your sleep partner notice that while you're sleeping, you intermittently not only snore heavily, but also actually stop breathing? It's important to note that the sleep partner is usually the one to notice this, because patients, until the condition gets very severe, often have no idea that they stop breathing during the night. And then the P is for pressure, or high blood pressure, because patients with sleep apnea commonly end up with high blood pressure. Then there are 4 more items on the questionnaire. The first is age. If your age is greater than 50, that's a significant risk factor. If you're male, that is a risk factor. If you are obese, and the guiding figure that we use for that is a BMI of 35 or more, and we won't go into that because it's a fairly complex figure. But basically, the more obese a patient is, the more likely he is to have sleep apnea. And finally, the 8th item on the questionnaire is neck circumference. The larger one's neck circumference, the more likely one is to have sleep apnea. And the cutoff point that we worry about for females, for women, is 16 inches and men 17 inches. Now that questionnaire gives us 8 opportunities for a positive or negative response. If you have 3 positives out of 8, the information is that that's likely that you have a moderately high likelihood of significant sleep apnea. The higher your number as you get up into 4, 5, and 6, the more likely you are to have significant sleep apnea. Now, so those are the symptoms. That the diagnosis is actually made during a sleep study. Would you like to talk about sleep studies now, or shall we come back to that later?
We could come back to it.
Okay, let's come back to that.
All right, I do wanted to ask you, this is a condition that wives, in the middle of the night, the husbands wake them up and they're snoring, and then all of a sudden they stop breathing. And then you sit there and you wait and you wait, and you think this man is never going to breathe again, and then he does take a breath.
Right.
How often does that happen during the night?
Well, it can happen anywhere from, in mild sleep apnea, it can happen maybe only once or twice a night. In severe sleep apnea, it can happen many times an hour. It can happen 10, 20, 30 times an hour. So it can be almost, in a severe case, it can be almost every time a patient falls to sleep, within 30 seconds to a minute, he is gasping and obstructed and short of breath, and the wife punches him.
How long do the pauses last?
Well, officially, a pause is greater than 10 seconds. That's what is, that's the cutoff point for calling it what's called apnea. An apneic episode is defined as more than 10 seconds of stoppage of breathing despite a respiratory effort, despite trying to breathe. But they can last much longer. It can be 15, 20, 30 seconds. The more severe it is, the longer the pauses are before the body is aroused enough. The brain senses lacking oxygen and too much carbon dioxide because of the stopping of respirations. The brain then arouses the patient. The patient wakes up enough to breathe, sometimes totally awake, but often just a little bit more awake, not enough to be even aware necessarily.
And there's always snoring associated with this? Almost
always. That is really the hallmark of this syndrome, and usually it's a syndrome that gradually progresses with age. As you noticed, one of our questionnaire items is age. The older you are, the more likely you are to get it, and that's because as we get older, our muscle tone just naturally decreases. One of the many things that decreases as we get older, muscle tone, not only throughout our body, but also in the back of the pharynx, decreases with age. So the older you are, the more likely you are to have that problem. So initially, say a 30-year-old man may snore a little, and gradually with time he gets heavier, he gets older, the snoring gets worse and worse, and by the time he's 50, he's got full-blown sleep apnea. That would sort of be a classic example. And I should say that men are much more likely, as we've said, men are more likely to get sleep apnea, but women certainly get it too. So, and again, similar risk factors, age and obesity, play into the women's situation too. It's more common in men, but it's definitely seen fairly often in women too.
Does heredity have anything to do with it at all?
Not necessarily, other than the fact that obesity to some extent is hereditary, but sleep apnea itself is not hereditary, no.
What about smoking?
Smoking is bad. It's bad for almost anything. As you all have heard over and over and over again, it's bad for a number of reasons. Smoking is bad for your heart. It increases the likelihood of heart disease. It increases the risk of emphysema and lung cancer. It increases the risk of many, many other cancers. With regard to sleep apnea, it does increase your likelihood of having sleep apnea, and we think it's because smoking causes irritation in the back of the throat, it causes increased mucus production, and it causes swelling from that chronic irritation in the back of the throat. And all that contributes to an increased incidence of obstruction to airflow.